This week is a mental health week, so I decided to do some questions on mental health. So, as usual, is a question form concept related. So, I'll be answering most of these questions and I will show you how to approach them. If you don't know the content, I will circle it and I will tell you this is the two things you need to focus on to answer the question. What should the nurse tell the client? That means a statement need to be made by the nurse to the client. Then go and look for the case that is being presented to you. After that, then look for the buzzword and then connect the dot and rewrite the question on your own. And this is taking history from a client with epilepsy on carbamazepine who report a mixed period despite consistent use of oral contraceptives. Pregnancy test is positive. What should the nurse tell the client? Go back and underline key terms. There's so many information here. Don't worry about it. Client has what? Epilepsy. Is irrelevant to the question? Keyword is carbamazepine. That's your buzzword. Report what? Missed period despite consistent use of oral contraception. And the client is positive. Why? I've been taking birth control. I'm now pregnant. I'm taking carbamazepine. I've been taking consistently, right? Consistently. What caused me to become pregnant? That's what the question asks you. What do you tell the patient? You develop resistance to the oral contraceptives over time. The word is resistant. Is it true? You have to know carbamazepine and birth control. They're related. They're a concept there. They talk to each other. Birth control and carbamazepine is your key. What is the relationship between the two? Carbamazepine caused hormonal imbalance. Does it do that? Leading to contraceptive failure. That's what it do? Carbamazepine increased the metabolism of oral contraceptives, reducing its effectiveness. That's why she's pregnant? I don't know. You be the guess. The oral contraceptive failed to prevent ovulation due to improper adherence. This right there is paying attention to details. And there's a word in the question that tells you option D is way off, right? There's a single word in the question that negates this. And if you choose it, that means you're not paying attention to the question itself. The answer choice is oral contraceptive failed to prevent ovulation due to improper adherence. Like I said today, I'm trying to show you when you answer the question, these are the things you want to pay attention to. Why this is not true. Look at the question. It said, and this is taking history from a client with epilepsy on carbamazepine who report a missed period despite consistent. That means she never missed a pill, always using it, consistent. And improper adherence does not go well with being consistent with medication. Therefore, D is gone. You left with this. This is all content. You have to know how carbamazepine affects oral contraception. That is why we tell you the content here. If you take carbamazepine, oral contraception, you should have what? Barrier method. There is a reason why. If you read it, watch a video, they always talk about it, right? They have to tell you why you have to use a barrier method. And that answer choice is what is over there. So what do you think? Why, if you're on carbamazepine, we tell you to have a barrier method like condom instead of oral contraception? So carbamazepine make oral contraceptive ineffective. So effectiveness is reduced. It does not cause hormonal balance. It does not cause resistance. And of course, the patient has been adherent to the prescription. Therefore, effectiveness is what is affected. That's why that's the right answer. So C is your right answer. So for this, that's what you have to pay attention to. And I'll give you some explanation. Number 2, same thing. Which of the following statements the nurse should prioritize? That means what would you, if you have to say something, which one is more important to prioritize? And this is assessing a client in the emergency department who is taking what? Clozapine for schizophrenia and report feeling unusually drowsy and having excessive salivation. Which of the following statement the nurse should prioritize? I'm going to give you the keywords. You should prioritize. That means all these statements you can ask, but one of them is the best. You have to be sharp. A nurse is assessing a client in the emergency department who is taking what? Clozapine, right? For schizophrenia. It tells you this is antipsychotic. And report feeling what? Now drowsy and excessive salivation. What question are you going to ask? And if you have to ask, which one should be your number one? When was the last time you had alcohol? Have you stopped smoking recently? Are you taking any Tramadol for pain? Are you short of breath? This is a content. If you never heard about it before, you should know this. Carbamazepine, Clozapine is antipsychotic. Patient is now having drowsiness and excessive salivation. What question were you going to prioritize? Which of this one is more important to ask the patient? What do you think? Content. Clozapine is an antipsychotic. One of the medication things we tell these people, if you take clozapine, if you never heard it about it before, today you're an adapting class. And you should never forget this in case you see it in your test. One thing people who take clozapine is they should not smoke. Smoking is bad. Smoking, what we do is break down clozapine, right? If you're smoking, your level of clozapine will decrease. Therefore, this patient is having signs and symptoms of excessive clozapine. So these are all some of the side effects of the medication. It means that they've stopped smoking recently. They stopped smoking, now they have high level of clozapine, and that is what is causing the early sign. I know you see shortness of breath there and you pick it. Yeah, no, it does not answer the question. Tramadol, it would be good if it's they take like SSRI, right? Alcohol, of course, is not it's bad. I mean, but most medication we tell you not to take alcohol with it. But this is related to smoking. Smoking is bad for patients who take clozapine because it decreases the effectiveness. As soon as they stop smoking, the level of clozapine goes up and they start having signs and symptoms of overdose of that. So side effect, smoking. Write it somewhere and don't forget antipsychotic clozapine is number one. Okay, and that's the explanation. So it's no shortness of breath, it's not anything like that. It's all based on that. And I set it in order to trap a lot of people. When I say questions, I want you to think, don't see a big word and then jump on it. And please do that all the time. You say, oh, I know it. You pick it. It's wrong because it's not answering the question and the content is not related to what you pick. Shortness of breath is not related to that. I know airway. Well, it's not every airway. Everybody want to pick airway, Same thing, right? Which statement by the client is appropriate? And this is assessing a client in an outpatient mental health clinic who has depression and takes Selegiline. Client blood pressure is this. It's the same concept. Like I told you, this is a mental health week. I want to give you questions that make you think critically. So you take the NCLEX, the questions become easy, right? Appropriate statement. Patient came in to the mental health clinic. He has depression, okay? He takes Selegiline and his blood pressure is now this. Connect the dot. I have depression. I take Selegiline. My blood pressure is this. What were you going to say to the patient? Can you tell me when was the last time you took your medication, right? Have you ever been diagnosed with elevated blood pressure? Have you recently taken any over-the-counter medication for cold? How often do you check your blood pressure? Same thing. Strategy, but go with the content. Forget about the answer. Figure out what I'm trying to ask you. And I've led you to the journey. Depression, Selegiline, hypertensive. What will you ask this patient? You have to know what Selegiline is. If you know what it is, the answer choice is easily. It will tell you why this blood pressure is high. And if you know what will cause patient on Selegiline blood pressure to be high, you can figure out the answer choice right there. So, what do you think? What is the problem? People with Selegiline, which is the MLIs, we tell them not to do certain things. Don't take over-the-counter medication because he has pseudoephedrine, right? Pseudoephedrine is the most common component of cold mixtures. And these cold mixtures can increase your blood pressure. That is what they do. You know, when your nose is running, well, you go and take Sudafed. What do you happen? Your nose dries up. Do you know how they make your nose dry? They have vasoconstriction. They vasoconstrict your vessels. Which hormones do that? Neurotransmitters, norepinephrine, which increases your blood pressure. So if you have hypertension and you take cold mixtures, expect your blood pressure to go up. If you take Selegiline, you have high level of norepinephrine or monoamines. You go and take over-the-counter medication, your blood pressure is going to go up. So that's what the best question to ask this patient is that. Okay. Once again, you see the question, don't rush. Go back. Which instruction? Don't look at the answer choice. Which instruction the nurse should question? Which one would that question? Then you say, the nurse is reviewing physician discharge instruction for a client post open reduction internal fixation. It's irrelevant of left tibia. He had surgery because the tibia is like broken. Don't worry about it. It's irrelevant. Client has history of bipolar is very important, and he takes lithium. These are the buzzwords. So rewrite it again. A patient who take what? Lithium for bipolar is going home after surgery. Which of these instructions should you question? Right? Take Tramadol for breakthrough pain. Take ibuprofen every 8 hours for pain. Call the clinic with redness, swelling, drainage from the wound. Elevate and hides the leg. Which of this are you going to question, you the nurse, when you get this order for his patient who is going home? Which order will you question? That is what the question is asking. What do you think is the most important thing? Once again, keyword, patient had surgery because his leg is broken. And then the patient is going on, but he has also bipolar disease. They take lithium. And you're giving them this instruction. Which of these instruction is bad? So you got to question this instruction that the provider has given to you to tell the patient. Take Tramadol for breakthrough pain. Take ibuprofen every 8 hours. Call the clinic with redness, swelling, and drainage of the wound, and then elevate and ice the leg. What do you think, guys? If you read a question wrong, you're going to get it wrong. If you read it appropriately, you'll get it right. Well, with the question. Well, Tramadol is narcotic. If you have this big surgery, there's nothing wrong with it taking that pain medication. It does not react with lithium. Ibuprofen, it hates lithium. Lithium, your kidney, and NSAID, ACE inhibitor, dehydration, they don't go well. Four things, if you're going to take the NCLEX, that four things I've stated, every time you hear about lithium, I want you to repeat it to yourself. If you see a question, they don't talk about it, email me. If you see a question, they talk about lithium, and yes, they don't talking about your kidney. They don't talking about NSAID. They're talking about ACE inhibitor or dehydration. Let me know. Or maybe let's put some salt there. So this redness and swelling and drainage calling me is a good thing. If you call me, it's good because you have infection. Elevate your leg so that you don't have swelling. It's good to call me. So that's not bad. So the only thing you need to question is this. The kid should not be patient should not be taking Motrin because it's on lithium. It will make lithium toxicity. So that's the one. And next is the same thing. This is the same thing, but I change it. And next cares for a client with bipolar disorder who is prescribed what? Valproic and Lamotrigine for mood stabilization. The nurse should monitor the client for what? Once again, connect the dot. We need to monitor for something because the patient is on valproic acid and Lamotrigine. He has bipolar. What should you monitor for? Polydipsia, muscle rigidity, widespread erythematous rash and mucosal involvement, clonus, or hyperreflexia. A little bit hard one, but trust me, take it easy, slowly, and you can see that you'll figure it out. It's not easy. I mean, it's not hard, right? Valproic acid and lamotrigine, you have to know what these are. But I give you an idea. I said they are mood stabilizers. They are anti-epileptic. If this patient is taking it, which of this will you monitor for? Polydipsia, muscle rigidity, widespread erythematous rash or mucosa involvement, or clinician hyperreflexia. What do you know about those two medications and what do you need to worry about? It's an anti-epileptic. There's something you need to know about anti-epileptic. And the number one, they are all sulfur drugs. It's a sulfur drug. One of the biggest side effects of sulfur drug, Stevie-Johnson syndrome. Do you see Stevie-Johnson syndrome there? I did not put Stevie-Johnson syndrome there because I know you'll pick it. I put bad ones, muscle rigidity. This is NMS or malignant hyperthermia or maybe serotonin syndrome. Polydipsia, maybe lithium can do that. We're talking about mental health. Clonus hyperreflexia is like serotonin syndrome. This is what you see. Widespread erythematous rash and mucosal involvement. That's Stevie-Johnson syndrome. It's a little bit tough, but that is the way it's supposed to be. So this is what you should monitor for. Valproic and Lamotrigine. Know that most 99% of anti-epileptic, they are also for drug. So you test the patient. They may have photosensitivity, and they may also watch for Stevie-Johnson syndrome. So C is your right answer. And this is based on the same thing, right? Which of the following prescription the nurse should suspect? A client with depression on staple dose of fluoxetine present to the emergency department with what? Agitation, diaphoresis, clonus after taking the first dose of a new prescribed pain medication. Which of the following prescription the nurse should suspect, right? Break down the question again. Patient taking some medication, what do you should suspect? Client has depression. You take fluoxetine, right? He presents to the emergency room with what? Agitation. Does he ring a bell? Diaphoresis. Does he ring a bell? Clonus. Does he ring a bell? Connect the dot. What will fluoxetine? Is he related to this? Agitation, diaphoresis, and clonus? These are your buzzwords. You're looking at them. Forget about the full question. Just these are the things you need to focus on. And then there's a word there. This happen after the patient take the first dose of a new prescribed pain medication. So rewrite it again. Medication. All of a sudden, he has agitation, diaphoresis, and clonus. What do you think is causing the problem? We have Motrin, we have ketorolac, we have Tramadol, we have gabapentin. Which of these do you think may be the cause of it? Let me give you the clue. I have SSRI. I'm having signs and symptoms of clonus, diaphoresis, agitation. These are symptoms of upper-going symptoms. This is serotonin syndrome. Which of these you combine it with fluoxetine will cause serotonin syndrome? That's all. That's what the question is asking you. Which of this, when you combine it, will do that? And test taking strategy, let's look at it. Motrin and ketorolac, they are all NSAID. So they will be doing the same thing, two things. So negative, negative. It has to be this one. Gabapentin is anti-epileptic. It has no reaction to, um, it doesn't affect your serotonin. Tramadol increases your serotonin level. And that's why it's the right answer. A client on long-term therapy of bipolar disorder is diagnosed with what? Lithium-induced diabetes insipidus. Lithium-induced diabetes insipidus. Which of the following the nurse know is consistent with the diagnosis? Don't be surprised when they give you mental health question and he has endocrine. So this is how you connect system-based learning. Lithium-induced diabetes insipidus. That's one side effect of lithium. So which of those do you see when the patient has diabetes insipidus, endocrine? Aspect, lithium-induced diabetes insipidus, right? Do you see dry mucous memory? You see polyuria, polydipsia, and glucosuria, dark pungent urine, and elevated serum osmolarity. This is endocrine, right? I know you know it. So DI, what do you expect in? Don't worry about the word lithium at all. In diabetes insipidus, there's no ADH. Therefore, you're going to lose all your water. If you're losing your water, right, you're going to get dry. Your mucous membrane will be dry. You're going to have a lot of urine because you cannot absorb the urine. You'll be thirsty. There's no glucose in your urine. This is a trap, okay? No glucose because this is not diabetes mellitus, right? This is diabetes insipidus. Your urine is not going to be dark and pungent because you have diluted urine. And if you lose all your water, your serum osmolarity goes up. This is the way you analyze things. And this is the way I try to make this content as simple, as smart as possible, using just one word, ADH. Therefore, dry mucous memory, polyuria, polydipsia, you don't see because it's not mellitus. Your urine is not going to be dark, it should be diluted, and your osmolarity is going to go up. We've seen this question before, but in a different form. Which of the following the nurse should expect to apply? Don't pick everything. Pick those you know you're confident. If you know one and you are 100% confident, just pick it and leave the rest alone. But if you know it, don't leave it alone, right? Don't do 50-50. And nurse is assessing a client in emergency room as ADHD. What do you give them? Amphetamine. He said dextroamphetamine. Don't worry about it. It's an amphetamine, right? Which of the following should the nurse suspect? Keyword, right? Is overdose. Amphetamine is a stimulant. If I give you a stimulant, your symptoms should go up going. And me test taking strategy, I'm looking for the answers that shows I'm going up. Tachycardia, I'm going up. Restlessness, I'm going up. My blood pressure is going up. I'm hallucinating, I'm going up. My pupil is bigger, I'm going up. Okay, that is the key. You can see how you can answer this question. And what do you do? If everything is going up, you start having seizures. You give them what? Benzos to slow them down. Naloxone is for opiates. And then you're done. So every time you see amphetamine stimulant overdose, remember to give them benzos to calm them down because everything is going up. Tachycardia, restlessness, elevated blood pressure, hallucination, dilated pupil. Then to calm them down, you give them benzodiazepine. Test taking strategy based on just focusing on the amphetamine, which is the stimulant. What should the nurse expect? Select and apply. A client, this is the same thing based on the other one. A client prescribed paroxetine for depression recently started taking an herbal supplement containing St. John's wort. The client now presents to the emergency department and the nurse is preparing for what? Assessment. The nurse should, what should the nurse expect? Break down the question. You know the answer before even looking at the answers. Paroxetine is an SSRI. Now patient is taking St. John's wort. Is it good? He came into the emergency room. What are you going to see? SSRI and St. John's wort. What will you see? Symptoms of neuroleptic malignant syndrome, hyperreflexia, confusion, clonus, diaphoresis, tremor, MOI, induce hypertensive crisis. What do you think? Right? Paroxetine plus St. John's wort will give you what? And therefore, if you know what the what is, what are your symptoms that you're going to select? So paroxetine plus what? St. John's wort is called serotonin syndrome. Therefore, which of this do you see in serotonin syndrome? We're not going to see neuroleptic malignant syndrome because it's not that. Your hypertension is not due to MOI because it's not MOI. Therefore, you see hyperreflexia because things are supposed to go up. Confusion, things are supposed to go up. Clonus, things are supposed to go up. Diaphoresis, things are supposed to go up. Tremor, things are supposed to go up. So this guy, those are your answers. A nurse care for a client in emergency department with a history of generalized disorder who abruptly discontinues long-term benzodiazepine use. The client is now experiencing tremor, agitation, and seizures. Which of the following medications should the nurse prioritize? I want everybody on the line try this. This is just to trap you, but it's a straightforward question. Think about it. And this is a trappy question, but it's not trappy. It's just you have to pay attention to the question, and if you pay attention to it, it's easy, right? Don't pick A. Flumazenil is an antidote for that. You're going to kill the patient. Why? Patient has generalized anxiety disorder. They stop their medication, benzo, abruptly. You're not supposed to stop benzo abruptly. If you read it too fast, you mix it. You cannot stop benzos appropriately. She's having seizures and tremor because she stopped her benzos. If you give her benzos back, she will be fine. If you give her flumazenil, you're taking all the benzos that she has left and is going to be in trouble. These are one of the questions. This type of question you should watch out for. It's a trap question, but it requires you to be careful, critical thinking, that patient just stop their medication and having seizures. And don't block anything. Just give it this. It's not opiate, so this is gone. You're not going to give him antipsychotic because he stopped taking a benzos. So D is your right answer. So if he trap you, yeah, be careful when you read it. So that's the idea. Which of the following interventions should the nurse perform first? A client with bipolar has been prescribed lithium carbonate for mood stabilizer. The client presented to the emergency department confusion, cause tremor, and excessive taste. It should be excessive taste. Which of the following should the nurse perform first? So once again, patient take lithium, right? And he present to the emergency room, confusion, cause tremor, excessive test. This tells you this is toxicity of the lithium. What would you do when a patient come in who is having lithium toxicity? Provide fluid and monitor the renal function, place the client on seizure precaution, give them sodium bicarbonate, or check lithium level. Think about it. Patient is having lithium side effect, confusion, cause tremor, excessive test. And then what would you do first? Right? Fluid, monitor the renal function, and give them seizure precaution, sodium bicarbonate, and check their lithium level. What do you think is the most appropriate? Mental Health Week, I know you got this. What do you think is the most appropriate right now? What will you want to do? Why is lithium toxic? Number one reason that lithium is toxic is dehydration through your kidney function. Anytime, I just said it, I give you all the things you need to worry about when it comes to lithium. Dehydration and your kidney. Do you see answer choice related to that? I know you're going to provide seizure precaution. Patient is not having seizures. If you're providing seizure precaution and the patient is still having high lithium level, you're not helping them. You're waiting until they have seizures? No. Sodium bicarbonate is used for TCA. Checking the lithium level will give you an idea, but it's not going to help you. Give them fluid to prevent ongoing assault. Fluid and monitor their renal function. That's the first thing you do to prevent ongoing toxicity. Of course, you're going to provide seizure precaution. Of course, you're going to check the level, but slam them with fluid, and this will dilute the lithium and let the kidney get rid of it. So this is the thing. And this is the last question. Which of the following finding a nurse should expect on the further assessment? A nurse is assessing a client with depression who present to what? Who is stable on fluoxetine, who present to the emergency department with agitation, tachycardia, and hypertension. What do you see next? This is a straightforward. Once again, SSRI. Always look, they will give you the disease process, depression, what medication you use, fluoxetine, what is the things you should see when you have excessive overdose of that, agitation, tachycardia, hypertension, serotonin syndrome. What else would you want to do? Or you want to see serotonin syndrome, symptoms should be going up. Constipation, symptoms going down. Decreased tender reflex, symptoms going down. Clonus, symptoms going up. Hypothermia, symptoms going down. You know the right answer, right? This is your answer. And this is a second portion of it. Don't get trapped with that. Which of the following prescription, you got to look for the words. The nurse should anticipate to treat, look at this one, treat the underlying condition. Underlying condition. A nurse is assessing a client with what? Depression. Stable on what? Fluoxetine. The same question. Present to the emergency room with agitation, tachycardia, and muscle rigidity. The same thing is SSRI. But the question is asking underlying condition. Underlying condition is excessive what? Serotonin. Therefore, pick an answer choice that is going to affect your serotonin level. And what would you pick? Which of this will you pick that is going to affect serotonin level? You know, propranolol does not do that. Lorazepam does not do that. Guess what? We can use this for serotonin syndrome to treat the tachycardia, agitation, right? But this is a serotonin antagonist. It's going to bind to the serotonin. So cyproheptidine. So know this. Don't forget it. And this is end of it. Thank you for watching.